You're listening to the Sea Change podcast, covering the trends and issues in Southeast Asia.
Hello all, my name is Nick Basson and welcome back to another episode of the Sea Change podcast. It's fantastic to have you all back again and listening to us. Today's episode is very exciting. It will feature Glenn Keys, who is the founder and executive chair of Aspen Medical. He's had an extensive career in Southeast Asia and also globally. To kick off our conversation, Glenn, it'd be great to hear more about your experience in the region and what brought you to work in Southeast Asia.
Yeah, thanks very much. Well, my initial career was in the military, and so that was obviously very military focused. But when I left the military, my very first job was in a startup whose number one contract was in Indonesia. And it was actually working with IPTN, the Indonesian aircraft company, and helping them export to Australia. So that was a drinking from the fire hose introduction to the region and particularly Indonesia. And so I was up in Indonesia every month, maybe 4 to 6 weeks, for a week to 2 weeks at a time, and really just immersed working with Indonesians every day, understanding the culture, understanding how they did business, watching as the Asian tigers grew, and then helping them, if you like, translate to an Australian and a government context for what they were trying to do and growing into the Australian market. So that was almost 30 years ago. Sadly, that dates me quite significantly, but probably at a time before a lot of companies were excited about Southeast Asia and working in Southeast Asia. I was up there a lot and getting to know a lot about the culture and the diversity, but also the potential and the opportunity that was and still is Southeast Asia.
Fantastic experience there. It'd be really interesting how we go through this podcast and maybe we get a comparison to what it was like back in the day and what it's like now in Indonesia and Southeast Asia. To begin our conversation, I'd love to hear more about Aspen Medical's view on Indonesia and specifically West Java and why that was identified as an attractive market, and then maybe some insights about the project, what we're looking for, the time horizon, and so on.
We've always had an interest in the region, and because of my connection before Aspen Medical into Indonesia, we'd always had an interest in there. We'd been up to Indonesia a number of times, meeting companies, getting to know people. You know, I think a lot of people when they start going to Asia go, oh, it's all about people and it's all around connection. But I actually think that's every country in the world. We all want to trust the people we work with. We all want to know them. We want to feel comfortable with them. I don't think anybody in the world, any culture, likes doing work with people they don't trust or get on with, and Indonesia is no different. So we'd always been interested in the region, was always just trying to find the right opportunity. And we'd actually done a lot of work pre-COVID with a couple of different medical groups, primarily in Surabaya and Jakarta. And the opportunity in West Java didn't really come up until right at the very end of 2019 and really started to mature and shape during COVID to get an understanding of what it was going to look like. So our previous work had been over in Surabaya and elsewhere, but West Java really didn't start to come onto the fore until after 2020. And I think a lot of it's driven by the governor, driven by the leadership. The governor of West Java is a really forward-thinking individual. I think he understands some of the key aspects of what's required to grow his province, to give it the economic uplift he wants to see for its people. So we've been working closely over the last couple of years to help shape that. And we've invested a lot over that time to work with them as their ideas have developed and shaped into what's now looking like going to be really quite an amazing healthcare project.
What I really liked about this deal as well is over an extended period of time. It's not just a 5 to 10 year horizon, it's 20 years. Is there any particular reason you chose to go with that longer time horizon for this particular project? I understand the capital intensity of the medical industry. It's often better over the long time horizon. But is there any other reasons surrounding that?
Look, there are a couple. One is, if you're going to amortise your costs back, it's better to do it over a long period of time. The other is Indonesia is the largest public health insurance market in the world. So 260 odd million people. It's an amazing opportunity, but it's not an economy where you're going to make a lot of money in a short period of time. Out of healthcare, you really need to build a long-term sustainable model. So that fed into it. And the last bit is that from a company point of view, a lot of our projects are just a few years, 3, 5, maybe 7 years long. And that comes with peaks and troughs, and you have to balance those to make sure you don't end up with all the troughs in the same year. A longer contract, maybe with a lower margin, but a longer period allows you to level out all of those peaks and troughs over a much longer period of time, gives you the longevity within your business, gives you tenure within a country, and allows you to leverage that tenure into other opportunities and other businesses. So we see it as good from a business point of view, good from a country point of view, because the longer you're there, the more you learn and understand, but also good from a broader company perspective of giving us that foundational business to grow into other areas that might be shorter term or more cyclical.
It'd be fantastic to hear a bit more about this project. For some of our guests, they might not have heard of the investment into West Java. So maybe a bit more detail about what you're going to produce there, kind of the impact on the community as well. How many people do you think this will affect, this particular project?
So I must admit, we're very excited about the project. And as I said, it's really only started to reveal itself in detail in the last year or two. It is going to involve the development of over 20 international standard hospitals and over 600 clinics and healthcare facilities across the country, all of which will be strategically located to address areas of need. And so we're doing a lot of work around where beds are, where beds aren't, where care is. About half of those clinics will be mobile, so we'll be able to do outreach into areas. And really what we're looking at doing is reaching the vast majority of population over that 20-year period within West Java. So the project aims to significantly improve healthcare access and quality in Indonesia, catering to that growing demand for improved medical services as the economy lifts, as people's disposable income lifts, as salaries lift, as the need for highly educated people and advancement lifts, so does the requirement for healthcare. You would know very well, Nick, that when you're entering a market such as Indonesia, it's really critical to understand the dynamics, the culture, and the challenges that a project like this could face. We did initial strategic planning work back in 2020, which involved an in-depth analysis of healthcare infrastructure gaps, population demographics, and market demand. We did a lot of consultation in the last year or two with local healthcare professionals, government authorities, and community reps to identify some of the most critical areas where our facilities could have a really substantial impact. The timeline for this project has also been developed to ensure that we effectively implement, that we don't overreach, and that we do it in a very, very staged way. But I think, a lot of what we've talked about is how we engage locally. How do we build trust? How do we identify the stakeholders and then engage with them? And if you're going to do a project on this scale, then you've really got to be able to do that in a way that will allow you to have a very localized solution, but allow you to scale that up. A lot of time and our resources have been allocated into building those relationships. And I think that that's given us a really strong project plan and has kept delays to a minimum while giving everybody comfort of the direction we're heading in. So, I think we've been able to also leverage the growing Indonesia-Australian healthcare cooperation to show that there are real opportunities for improving the healthcare of everyone, not just in, a large, perhaps high-end facility, but something that will reach out to everybody. And I think that that is really going to allow us to contribute to the cooperation agreement between Australia and Indonesia. And it'll bring together a lot of knowledge, expertise and resources from both countries that are really going to benefit everyone on the ground in Indonesia, where two of the hospitals are well advanced into master planning and permitting. Construction is set to commence later this year, and we'll be having state-of-the-art medical equipment and services that the communities really need. And we're also moving ahead in development of a number of specialised units to assist with the upgrade of services in 3 government hospitals. And that'll cover women and children, as well as cardiac and cancer care, 3 areas that are just in absolute high demand already. I think, as you can see from all of that, when you look across those 20 hospitals, 650 clinics, getting out into villages, engaging with local stakeholders, understanding government needs, clinical needs, there is a lot of planning, a lot of execution work that has to be done. But building that trust, engaging on a local level have been really, really critical. So, I think we're going to have an enormous and positive impact about creating healthcare accessibility, capacity and quality in an area around sustainable and patient-centred care in the country.
So you and your business have done a tremendous amount of detailed research to understand the Indonesian landscape. Why is it important to have a strong local partner? How does that help you enter the Indonesian market? What do you kind of leverage off them? What do you look for? How do they help you navigate the different processes in Indonesia?
Well, look, there's a range of things. I think part of it goes back to what I said at the start, that we all like to see people, know people that we could trust. If you've grown up in a country, that language is your first language, it's your culture, you're going to understand things better than anybody who comes from an external environment will ever do, no matter how committed they are to truly trying to understand things. A local partner will say to you, I think we need to be wary of this. I think we need more focus on that. I think these individuals over here, while they're not obviously stakeholders, are important because of this influence that they have. So they give you a read into culture, into stakeholder engagement and management, and into issue management and nuancing that you would really struggle with from outside. And you could probably do it without picking a local partner, but my view is it will take you a lot longer and you will make a lot more mistakes than if you are engaged locally. And I also think it's respectful. We've always believed wherever we operate in the world that we don't just want to come in like some, external force and deliver and live inside a compound. We want to grow capability and capacity wherever we are in the world. And to do that, you've got to engage locally. You can't do it by bringing people in from outside. You might grow capacity, but you won't grow capability. So I think it's respectful, and I think it's also a core tenet of the way we operate as a company wherever we are in the world.
So you mentioned that Aspen has a global reach all over the world. What do you find unique about operating in the Indonesian environment? We briefly touched on relationships are important, but it's also important in all different markets. What stands out to some particular nuances, some particular tips and tricks Australian investors might need to hear before they go into Indonesia? Would you have any advice on that?
I would say that you should have a local partner. What that local partner looks like. Are they an advisor? Are they a minority? Are they majority? They're all going to depend on what business you're pursuing, how it's going to look. So there's really no template there, but I think having someone on the ground that is from the country is very, very important. I think in Indonesia, the thing that I've always been struck by is what they don't say rather than what they say. That they're very respectful. They're respectful of the fact that you've travelled to the country. that that you've come to see them and you're engaged with them, but you need to be listening for always what's not said, what's not going to be put out front, because sometimes that respect means that not every issue is going to be laid on a table or presented to you. And so finding multiple pathways to check that you're on the right track, that there's no obstacles that you're unaware of, that there's no politics you're unaware of, those things are really, really important. So don't just think, I had a meeting, everybody said they were happy, we should move forward. What you should do is have 2 or 3 different pathways to check, is there anything we've missed? Is there a person we're not talking to? Are they raising every topic? Because maybe they're just being incredibly polite, but it's going to be terminal because you won't understand what's wrong and they're not going to tell you. So, that respect and that politeness can also mask an issue that you need to make every effort to try to uncover. And a lot of that's about you being respectful and understanding and making the time to go back more than once, more than one effort to get to a position to ensure that you've covered all of the bases and heard all of the voices.
Yeah, I love that point there, Glenn, because I find often on a daily basis myself, you really need to put the effort into going that one step further. The communication style is quite different to what we'd find in Australia, but there is that real need for that emphasis on getting to the bottom of it, understanding, taking the time, not rushing the process, which I think is really crucial to work in the Indonesian market itself. In terms of trade agreements, we've had IHEPA. Has IHEPA played a role in the development of Aspen's project in Indonesia? And also, is there any other free trade agreements that are coming up, being adapted, that are facilitating trade in the region for Australian businesses? We take a bit of a broader view here.
Just specifically the Indonesian-Australian agreement, I think is very powerful. I always find bilaterals are powerful because 2 countries have sat around a table and been very, very clear what's important to them and what's not. And I think it's a real credit to both the governments of Australia and Indonesia that they've been able to get to it. And if you look at, the gestation periods of agreements, some of them can take decades. This was done, I think, not in haste, but with speed. And I think why that's been done is because both countries have recognised the importance to it. It's been important to us because we've been able to be pointed to as an example of what can happen when Indonesia and Australia work closely together, when they're respectful of what the strengths and weaknesses are of each other's jurisdictions, what they could do better and what they could do to help each other. We've been very, very pleased to hear both governments talk about this project and the benefits that it will have, not just those tier 1 benefits of there will be people who will have better care, but the implications of how it will impact on productivity, how it will impact on growth, how it will impact on the economic development and acceleration of local economies across West Java. So we are really honoured to be held up as an example of what an outcome is of that agreement. And I think the ASEPA agreement and how we are part of it is something that we're really proud to be part of as well. The other agreements that I think probably play into it is the ASEAN Australia New Zealand FTA, the Free Trade Agreement. It's been around a long time. It's been around since about the beginning of 2010. And Australia has used it along with the ASEAN, the 10 ASEAN countries, to almost double the amount of goods and services to over $151 billion, I think, in 2021-22. And I think that is an absolutely amazing example. But it's worked both ways. Australia's been able to increase its exports by, I think it's about 160% since entry into the market. So ours are up to about 74 billion last year. And that's over 10%. I think it's getting up around 12, 13% of Australia's total goods and services exports. So how that FTA works between ASEAN, Australia and New Zealand, I think is, eliminating tariffs on almost 100% of Australian goods and exported out has been great for the markets and great for us. And I think it worked as a terrific exemplar of what the Indonesia-Australian agreement could be. So it was a terrific foundation not only to grow business, but act as a template for what could come and what is in place now. So we're very excited about what now comes forward as part of ASEPA.
Those free trade agreements have had a huge impact of what's going on in the region going forward. ASEAN, Indonesia, they'll be extremely influential for the future growth of Australian business and prosperity. I know today we've highlighted a lot of the positives, a lot of the advantages, a lot of the outward-looking future benefits of working in a market such as Indonesia and Southeast Asia. But I'd like to bring this back to the specific project basis. What are some of the specific challenges for healthcare infrastructure in Indonesia, and maybe how we can apply some of those lessons more broadly to a market perspective? What challenges do businesses face in Southeast Asia, in Indonesia?
Look, I think generally in the region, the regulatory environment can be challenging. Australia has worked quite hard, I think, to have a clear regulatory environment. It's not perfect by a long way. There is work to be done. But I think you go to somewhere in ASEAN and across Southeast Asia and you realise it is a different regulatory environment. It can often have overlapping requirements, and so you need to work out how does this bit of legislation impact his? How does the provincial requirements meet the federal government requirements, meet the departmental requirements? Also, there was legislation brought into a number of countries, Indonesia being one with the omnibus legislation, that was brought in during COVID. So they were brought in a hurry. They were brought in very clearly to be able to support business and healthcare, particularly during COVID. What that's meant, though, is legislation is one thing. Bringing in the regulations and rules and policies and procedures to then implement that legislation is another. And some of those are still being rolled out. We have found ourselves often as being the first people to ask and say, oh, this bit of the legislation, we want to apply it to here. How does that work? And there's a bunch of people sitting around the table going, that's a great question because no one's asked that before. And they're trying to overlay it against the current legislation. So that requires patience. That requires you to sit down and not get frustrated. Just go, okay, we get that you've got new legislation. We get that you haven't had someone ask this before. Can we help you do that in a way that is fair, that is in the spirit of what that legislation is and the intent of it, but is also going to allow us to move forward sooner rather than later? So, I'd have to say I think some of the biggest issues do relate to regulation. They're not ours. They're different in Vietnam than they are in Indonesia, which is different to Cambodia, and they're all different to Australia. So you can't just sit back and go, Australia's great. Why don't they adopt ours? Because we've got some pretty painful legislation as well. It is simply a case of going, how do we work with yours? And we have not found anywhere anyone being difficult or deliberately obstructive in what the legislation is. Everybody, particularly for healthcare, can see the manifest benefit, not only to individuals but the broader economy, of better healthcare. It's just sometimes getting it through the bureaucracy does take patience.
I like your point there about the regulatory system in Australia. It's very different to somewhere like Indonesia and Southeast Asia. But previous guests have talked about how there's this role you go through where you connect with government and you collaborate and you work together to find the solution. When you're having these new regulations come in, it is a collaborative effort. You need to understand the business side of it, but also the government side of it. So it's a difficult problem to solve, but that's where you come in with your local partner, the nuance of being in a particular operating market. There was one brief comment there about COVID. How has COVID changed the state of the healthcare system in Indonesia, and what learnings did Aspen take away from it? Did they take learnings from Australia and some of the other areas where you operate? But yeah, what is Indonesia looking like post-COVID-19 situation?
Indonesia was in a position where it could draw on a lot of its friends from around the world to help. Was it securing vaccines? Was it understanding the transmission of the disease? Was it getting rapid antigen testing? It was able to draw into a range of markets around the world. And I think it was quite clever in how it tapped into those things. It knew the most important thing was its citizens. And so it went out of its way to tap into those as fast as it could. I think what Indonesia learnt, and we've seen that with the appointment of the current health minister, was health is not something that previously sat independent to other stuff. Over here is treasury, and over there is industry, and over there is banking, and stuck over here on the left is health, and we'll get to it later. I think what COVID did in Indonesia, and we've seen it really clearly reflected by the current president, the current health minister, and certainly the governor of West Java, is that they've seen that health impacts on all of those things. You can't have a banking industry if people can't turn up to work because they're sick. You can't have a construction industry if people aren't able to get there, and you can't get the supply chain. You can't drive your economy for growth and lifting people out of poverty if you can't get people to invest because they're worried that their workforce is going to be perpetually ill. So I think what it did for Indonesia, and I think they grasped that learnt lesson really quickly, is health is now an enabler for all elements of their economy, all elements of government, from policy through to economics, through to justice. And I think they've grasped that very quickly. And I think this particular program, which I'll be honest with you, Governor of West Java had seen a long time before anyone else, has got it now national interest because they can see the tendrils of health impact positively on the rest. If you bring it up, and if you ignore them, it will negatively impact on them. So I think that's one learning that I've seen more in Indonesia than most other countries, certainly in sort of developed Western countries.
It's interesting you say that. A lot of people talk about Indonesia's huge population, which is growing. They're taking advantage of the demographic dividend, which is upwards of nearly 60% of their population that are working age. But you bring it right back to its core. If you don't have those underlying services, if you don't have a healthcare system that can cater for your population, it's very hard for people to actually work and drive that economic growth, like you mentioned. So I think that is a really, really important point there. Our last question here is moving into some of the health solutions. Is the disruption of health happening in Indonesia and more broadly Southeast Asia? What's some information about the telemedicine, digital health solutions? Is Aspen involved in that space?
Look, we are, but then again, I think everybody is. I think one of the great outcomes out of COVID was that telehealth as a principal primary method of engagement with people for healthcare accelerated, well over a decade in those early months of COVID. If you're going to be stuck at home, if you've got clinicians who can't travel, if you've got specialists who are in lockdown in different parts of the country, then you're going to need a telehealth solution to accelerate that. And if you're talking about a country like Indonesia, where it perhaps doesn't yet have the scope and range of infrastructure that it would like into every aspect of its population, then telehealth does that. And I think one of the real interesting things that's going to happen is Indonesia is already starting to leapfrog areas of Western developed countries, saying, we're not going to roll out, poles and wire for telephone communication to all parts of the country. That's just going to take too long, to cost too much, and get outdated too quickly. Whereas we can fly in or drop in 5G towers around the country that are upgradable, and suddenly we've in a matter of months, if not weeks, open up whole swathes of the country to high bandwidth communications that not only bring terrific telehealth solutions, but will bring fantastic economic development, because now you can reach out. Don't need everybody to move to Jakarta. Don't need everybody to move to Surabaya or Yogyakarta, because they can now be in these distributed areas across the country delivering their services. So I think a real positive outcome has been how accepted telehealth is by the population, how accepted telehealth is by government, and how accepted it is by clinicians. So subsequently, we will absolutely be integrating telehealth into all of our options, be it at a hospital level, the clinic level, all the way out into community, because I think the thing that I see in Indonesia that's critical to its growth is equity. The moment you have disparity, if you live in a city, you'll do well. If you live in a rural area, you won't. Then that produces a bifurcated economy, which is not good, and a population and a demographic. The more that you can get out telehealth into community, into rural areas, into villages, the more that you spread that economic growth, you spread the equity of healthcare, you lift the country so much faster, and you also then don't have the groaning infrastructure of capital cities there as well. So we will absolutely be introducing telehealth, but it's something that I think Indonesia as a country will benefit from more than most due to its population, due to its reach, and due to the savings that it will produce by not having to replicate all the developed world infrastructure around capital cities and have it as a distributed economy across the country.
It's an archipelago nation. It's upwards of 17,000 islands. It's very difficult to put all those physical infrastructure across Indonesia in an equal way. So I think different tools like telehealth will make a big difference in Indonesia, bring down that cost per unit so people are able to have access to those much needed services. I think today we've had a fantastic conversation. I know you've certainly opened my eyes about healthcare in Indonesia, but also I think we've learned some really valuable lessons how we can apply some of those learnings of Aspen in Indonesia throughout Southeast Asia. So I just want to thank you very much for taking the time out of your day and coming on the podcast.
Nick, it's been a real pleasure. I think we need more Australians looking to Southeast Asia. I was on a recent trip up to Indonesia and I was asked a question why business people from Australia are comfortable to get in a plane and fly 18 hours to a 260 million person market in America when they could fly 7 hours to a 650 million person market in Southeast Asia. And it's a question that not enough Australian businesses ask themselves and not enough boards ask themselves, because I think the potential, the growth, the projections for growth in Indonesia and the region are an enormous, and we as a nation do ourselves a disservice by not looking to some of our closest neighbours in Southeast Asia to work better together and certainly to create a better world for both of our countries.
Very well said there. Thank you very much for coming on the podcast.
No worries at all, Nick. Thanks very much.